Hello, everyone. Heather Holmes here with KTVU Fox 2 News in the San Francisco Bay Area. And joining me this afternoon is Cathy Kennedy. She is president of the California Nurses Association. And the union is critical of the governor's recent decision to lift the stay-at-home order. We're going to be talking with Cathy about that. Thank you so much for being here.
Thank you very much for having me, Heather.
First of all, tell me why you disagree with the governor's decision.
Well, because, this is a pandemic. And, it's really important for us to, not to lift the stay-at-home orders too soon. Because as a registered nurse, what we're seeing day in and day out are patients coming in extremely sick. So we're real concerned about that lifting it too soon, we need to really stay vigilant because we're not through with this virus yet.
The governor says that the numbers, though, are showing a downward trend.
Okay, they may be showing a downward trend, but what we're seeing in the hospitals that are people that are extremely sick. So now's not the time to, lift those stay-at-home orders because, we really, as a registered nurse, we deal with this day in, day out. And we need to be able to provide care for our patients, yet the hospitals are violating the patient to nurse ratios right now. So nurses right now are caring for way too many patients that they should be caring for. So
sorry about that, Cathy. What are you afraid might happen now that the order has been lifted?
We're going to see more patients that are going to come in sick. And, we're going to be at the same place that we are right now, struggling to care for these patients, to provide them with the care that they need, and to make sure that all of the healthcare workers, the nurses, everyone have the proper PPE that's necessary to keep us safe.
And what about, are you concerned at all about the new variants of the COVID-19 as well?
Yes, we are. We are. I mean, you listen to the news every day. I mean, this is another it's a variant of the virus that we still don't have a handle on. So we are very concerned. And again, with the ICU capacity being what it is, hospitals asking to have that waiver in place so that nurses care for more patients, it's just not a good thing. So we're concerned.
Are you afraid that more of your nurses might actually contract COVID-19?
We always are. I mean, we've been asking hospitals to provide testing for all of the healthcare workers. That's been a struggle. Contact tracing. We aren't even told, if we're told if we're inadvertently exposed, but days later. So yes, we're concerned. 311 registered nurses across the United States have died. Come on. Yes.
Again, though, the governor cites improving numbers as a reason for lifting the order. What do you believe is behind the easing of the restrictions?
Profit over patients, over people is the concern. We really need to get people to understand that this is a public health crisis, and really, life should matter. Yes, it's important for businesses to be reopened and all of that, but if we are not vigilant and really take this seriously, we're never going to get rid of this virus. So it's a very big concern.
And Cathy, what do you say to those businesses who look at the numbers and really believe that, okay, we are in a better situation and now I can start to open my business and I can start to welcome customers back? What do you say to those business owners?
Well, again, as a healthcare worker and what we see in the hospital every day are those individuals that maybe have a local business and all of those things, but they are also become patients. So while we understand that you need to operate your business, but at the same time, it's important to really take a look at what we're talking about right now, which is a public health crisis. Where are you going to be if you're sick anyway? And people are dying left and right. We've got to get a handle on this, but we also need to make sure that, things are in place. And we've been saying that from the very beginning. Now that President Biden is in place, he's talking about, utilizing the Defense Production Act. He's really talking about putting money into the hands of people. But yet we still are saying you need to be cautious. You need to stay at home, only go out when you absolutely need to. It's important that we do the contact tracing, the COVID testing, and the immunizations, all of that. But we're just not there yet. In California, it's been terrible these last couple of months.
How long would you have liked for the stay-at-home order to be in place? I mean, were you thinking 2 more weeks and we might be in a better place, or a month from now after the numbers from Thanksgiving and Christmas and the New Year really start to subside?
I would say, this is my own personal opinion. I think that at least another month, 2 months, as the vaccines are coming out, as we're doing more, once we get that public health infrastructure in and we have all of the things in place, I think that we may be at a better place in a couple of months from now, but not now. Yes, we're trending down, but it's still an issue.
And so finally, Cathy, what would you like to say to the governor?
We need to have everyone stay at home, and that we really need for him to think about what he's doing. I mean, it's human life here. And as a registered nurse, we see this every day. I hear nurses crying. I mean, 50-year-old patients that walk in a little ill and end up dying. I mean, this is the reality that we're living in day after day. And it's important that we remain vigilant, get everything in place. Now's not the time.
And finally, Cathy, again, you talked about getting everything in place. What do you think would be the good steps to take? What improvements would you like to see before you and other nurses would be comfortable with the stay-at-home order being lifted?
Well, first, I'd like to see the hospitals, remove those waivers and make sure that we have the state nurse to patient ratios here in California so that nurses can provide the care for the number of patients that we have in place, and not ask for that waiver, and nurses are caring for more patients than they possibly can. So I'd like to see that happen. Also, contact tracing, COVID testing, immunizations, all of that. People need to stay at home, wear their face mask, wash their hands, socially distance, continue what we're doing.
All right. Cathy Kennedy, really appreciate it. California Nurses Association President. Thank you again for joining us.
Thank you, Heather. Bye-bye.